Let's try to solve a very interesting question. 26-year-old man comes to the office with several months of dysuria and increased urinary frequency. He also has blood in his urine at the end of the urination. So what we called it as terminal hematuria. Terminal hematuria. A month ago, he finished 7 days of oral antibiotic for UTI, but his symptoms did not improve. The patient has no other medical issues and takes no medications. He immigrated from Ghana, that is the sub-Saharan African region, 2 years ago and worked in the chemical fertilizer factory. He smoked a pack of cigarette daily and occasionally drinks alcohol. He is married, has no children. The temperature is 99, blood pressure 130/80, pulse 76, no abdominal mass or suprapubic or costovertebral angle tenderness. What does this indicate? There is no acute pyelonephritis. Genital examination is normal. The lab values hemoglobin little low, MCV low, indicating iron deficiency, but that could be secondary because of the blood loss in the urine. Platelets are okay, leukocytes okay, except for the eosinophils. So this is a big giveaway that some kind of parasites activity going on. A dipstick urinalysis shows one positive for blood, otherwise negative. Which of the following best next step? So here this is a young patient who immigrated from Ghana, has urinary symptoms, terminal hematuria and peripheral eosinophilia, raises the suspicious for the schistosomiasis. Very important. Schistosomiasis. It is a parasitic blood fluke infection that affects more than 200 million people worldwide. The greatest prevalence is in sub-Saharan Africa, which this patient is from Ghana. Schistosomes live in specific types of freshwater snails and humans in endemic areas and are often infected as children while bathing in the contaminated fresh water. Although 5 different species of schistosomes cause human infection, urinary schistosomiasis is typically due to Schistosoma hematobium. Patient with urinary schistosomiasis is usually asymptomatic initially, but chronic infection are marked by bladder inflammation and scarring with resultant dysuria, urinary frequency, terminal hematuria, as well as peripheral eosinophilia is seen in 30 to 60% of cases, and anemia is due to chronic blood loss, which all we can find in this patient. Diagnosis required the identification of eggs using urine sediment microscopy. That's the option E. Urine sediment microscopy is the confirmatory diagnosis to identify the eggs of schistosoma, and the treatment would be praziquantel. Praziquantel is a treatment and usually it is curative. Abdominal ultrasound we usually don't do because because the ultrasound we usually it is not diagnostic, but it could be suggestive finding. So this patient requires identification of the eggs by microscopic examination of urine, but not the abdominal ultrasound, which can definitely the abdominal ultrasound can show bladder wall irregularities and urethral scarring, but still it is suggestive finding. We still need to go for the definitive thing. CT cystography. Now chronic schistosomiasis can be associated with bladder cancer, which usually presents with intermittent gross painless hematuria, but the hematuria here will be present throughout the micturition. Throughout the micturition, we would think the bladder cancer. But here the terminal hematuria, it is schistosomiasis. So, but this patient has terminal hematuria, peripheral eosinophilia, dysuria. So first we will evaluate for schistosomiasis rather than going for uh, CT cystography to check the bladder cancer. The expressed the expressed prostatic secretion culture, this is very confusing option and many might choose this option. It is used to diagnose chronic bacterial prostatitis which could be seen in this patient. However, this patient from Ghana with peripheral eosinophilia, which we should just see that there is no bacterial involvement, some kind of parasites activity going on which can be seen with the eosinophilic findings. The last option is plain abdominal radiography. It could be used to diagnose urinary bladder calculi, the stone, a potential cause of dysuria and hematuria. However, peripheral eosinophilia won't be seen if there is a bladder stone or bladder calculi. So there is no need for this thing. So our definitive diagnosis for this is urinary sediment microscopy to identify the eggs of the cystosoma. Thank you.